really, okay, who was?
Congressman? My name is Alexandria Cleland. I wanted to talk to you, wanted to know what the bill would deal with the concept of purging. It's when small companies lose their health care or their rates have risen so high because an employee became very ill, and subsequently, these are companies trying to do the right thing. They've done the right thing. They've gone out, even in this one instance, they were talking about a company that went off, got a high deductible, had their folks do a health savings account, and still an employee got sick with pancreatic cancer, and then they saw their rates rise. They saw an additional increase of 70% in their premiums. And I'd like to point to people listening to, this is from Business Week. This is not from, some liberal journal. What will the bill do to address this issue?
Yes, ma'am, if I could. According to the Commonwealth study, and I'm Vice Chairman of the Small Business Committee, I went down there purposely and asked for a waiver to be on a third committee, normally get two. So I'm on small business to show you Congress has a sense of humor. They elected me as a freshman as Vice Chairman. Right now, small businesses pay a tax and I say tax with quotes around it, of about 18% more for their health insurance plans than large employers. Right now, they're paying way more because they're unable, as kind of was mentioned here, to do what's called spreading the risk. If you're IBM, you got so many people that when Blue Cross Blue Shield comes up, they're negotiating for better prices because they can spread the risk among ill people like that. One person can really take a small company under. So here's what we do. First of all, we make sure that from here on out, no one can ever be denied in any insurance plan coverage. Number two, we permit small, and that means that if you have a pre-existing condition, let's say your daughter has cancer, that when she gets to 18, she can apply to any private health care plan, and they must take it. They must take it. So, number two, what it does is it says among small businesses that now, and it doesn't do it for all of them initially. It starts and gradually increases. For the first year, it says, if you have 15 or less people, second year, 25 or less people, third year, 50 or less people. It says we have created a new insurance exchange. Now let me talk about this. What it says, like a stock market, except you don't bet. It says any private health care plan insurance, anyone can have a private health care plan in. And what happens is the small businesses then, because they cannot afford themselves, because they can't spread the risk, there are people, let's say it's a small business with 15 people, those individuals get to pick what plan they want to be in. At the end of the year, if a lot of the healthy people all of a sudden went to one plan, but the unhealthy went to this plan, at the end of the year, it is the cost, the profits over here are moved a little over to here because we spread the risk among everyone. We spread the risk. So small businesses are going to make out under this plan. We will also pay up to 50% of what a small business does. If you have 50 or more people, depending upon how high your payroll is. If you enroll people who earn $20,000 like an average, we'll cover tax credit up to 50% of your coverage. So what we try to do, and the reason we are so intent on small businesses is 70% of all jobs in Pennsylvania are created by a small business. 90% of all jobs in Pennsylvania are in a small business. So the intent here was to begin to give them the ability not to pay 18% more, and then all of a sudden it goes to 23%, one person gets very, very ill. That's how we intended to help small businesses do